most hospitals, when you walk in, from the entrance you perceive smell. In this hospital where I clean, everywhere is friendly. That shows that we are not just cleaners, but we give hospitals clinical clean. That's our standard. I have my cleaners, I have my head cleaners, the cleaners report to the head cleaners. I also have my supervisors.
We do our job with love. And as a supervisor, I say I'm enjoying my job, although there are challenges that I face, but I'm coping and I'm enjoying my job.
You can see people coming in here, sitting on the floors. They don't mind to sleep on the floors. Those who have patients here, the relatives of patients come in and they are comfortable.
As of today, we've had 580 deliveries. Last month, we had 611, but we've had to report 5 unfortunate maternal deaths.
Once every month, precisely the last Friday of the month, we usually have the meeting. At the meeting, we will discuss the way forward. How do we perform more? What were the shortcomings of the month? How do we improve on them? This is basically what we usually do.
Going forward, it is clear that we have to develop a protocol for the management of patients with sudden collapse from amniotic fluid embolism. We know that the culture of autopsies and postmortems are not yet imbibed in us. So I think the best approach is for us to introduce it gradually. And the recommendation I have is that we will limit autopsies for now to patients with sudden deaths. So from now on, we're going to have consent forms in all the wards in the hospital. And the idea is that it is our responsibility as the caregivers, before moving the patients with sudden collapse to the state hospital, we should endeavor to get their consent for the autopsy.
Please, I think such a procedure should be optional because not everybody is interested in this.
You offload the problem to me, Abi. If I talk and refuse, I call the governor. Governor, please come and talk to these people. No, it's true now. Why are you laughing? It's true. Please, again, I'm stating it clearly. We have to move forward.
There are so many reasons why a patient can die suddenly, but we need to know the common ones in the environment, and without autopsy, we can't know. And that is why it is very important that we do autopsies. But you see, the problem is this. Even the caregivers, a lot of us who are caregivers already have problems with autopsies. You know, they feel, why should you? You can see the sentiment there. People are asking, let's make it optional. People don't have to do it because they don't see a reason why they should do it. It's just a societal problem. It's a social thing. We need to change our mind. We need to change our mentality, the way we see things. The autopsy pathology is not desecrating the dead. It's actually helping the living.
waisted, very low weight. So it was unfortunate we couldn't get the blood sample from the IV line that was set. So I had to go into the femoral vein to get a blood sample for analysis. The child there's a probable infection going on, very high fever. So we need to get blood sample for investigations.
Wọ́n ti bẹ̀rẹ̀ sí ní sick.
Nígbà tí wọ́n bí kòkòrò wà ní orí ọmú ìyá ẹ̀.
Kí ni kòkòrò wo ló ní?
Kí ni orí ọmú yẹn ó légbò. Ìgbà tó kọ́ ṣẹlẹ̀ mo ní kó máa fún. Ṣùgbọ́n bó ṣe ń fún yẹn ẹ̀jẹ̀ gbogbo àdàbí bàtà bá ní wọ́n ṣe gé ẹ̀jẹ̀ á máa dà sẹ́nu ọmọ ìwà ní à. Wọ́n máa fún lọ́mọ wọ́n máa ṣe bẹ́ẹ̀ mọ́. Wọ́n á ń yàgbẹ́. So bó ṣe ń yàgbẹ́ yẹn mo wá rí i pé ó ti rù and ó dẹ̀ ti pípé ó ti weak, that is ní nǹkan bí around 2 lóru má gbé lọ hospital. Nígbà tí wọ́n wá dé hospital yẹn mo wá rí i pé kò improve. So gbà tó dẹ̀ ti ṣàlàyé fún dókítà ẹ̀ mo ṣàlàyé fún tó dókítà tó pé fásitì mo ní ìbẹ́jà kí n lọ mother and child tí n bá wà débi yìí tí mo wà pé àwọn tí mo bá ń bí wọ́n á gbìyànjú mo dẹ̀ máa kọ́ ìwà fún wọn. That is my belief. So ń bẹ̀ yẹn wọ́n dẹ̀ ní kí n sẹ́yìn mo dẹ̀ sẹ́yìn pé mi mo gbé fúnra mi o.
Wọ́n ti gbé wá kò mí báyìí ẹ̀dọ́ gbogbo ọ̀nà fúnra rẹ̀ ń máa jẹun akẹ́ arẹ́rìn ara ayá ọ̀gbọ́n adé.
The abdomen is distended. Organs difficult to partake. Bad malnutrition, no immunization. So the fourth thing should be sepsis.
Yesterday I've used to, but today now there is hope.
Alágbàtà gbé wá yẹn ó lágbára gan but ó improve dáadáa ju tàná yẹn lọ.
Doctor. Ó ti kú.
This is my church. I was a formerly soldier. I found this church in the year 1989. Lọ́jọ́ yẹn, mo rí pé ìyàwó mi pè mí pé ara ọmọ yẹn ò dá. So ó ṣàn yàgbẹ́. Mo kàn rí pé ọmọ yẹn ò lè control ara mọ́, mo ṣe gbé lọ hospital nìyẹn. So gbà tí mo dé hospital, which is general hospital. So gbà tí mo dé rí bí wọ́n ṣe ń bẹ̀. So tí wọ́n attend sí. So ìtara pé bọ́mọ yẹn ṣe ń ṣe, mo ṣe gbé ọmọ nìyẹn. Mo ṣe wá sí mother and child. Lọ́jọ́ yẹn gbà tí mo dé débẹ̀ kẹ̀, mo dé rí pé wọ́n try, wọ́n sapá, and mo dé mọ̀ pé àwọn irinṣẹ́ pọ̀ ń bẹ̀. So tí o bá ṣe pé àwọn irinṣẹ́ tó pọ̀ ń bẹ̀, ọmọ yẹn ò lè lójú. Nígbà tí mo dé bíbẹ̀ yẹn kò lè lójú 30 minutes nígbà tá a ti lọ. Well, ọkàn mi ti wálẹ̀ because I believe nǹkan tó lọ́run bá ti lọ́wọ́ sí kò kì í lera, and it's a gift from God. So ó tún lè gba nǹkan yẹn at any time.
Ọlọ́run ló fún wa, Ọlọ́run dẹ̀ gbà á, so kò sí nǹkan tá a lè ṣe sí. Oore ọ̀fẹ́ ni, so gbàtí bá dẹ̀ ti gba nǹkan ẹ lọ, a gbọ́dọ̀ mójú kúrò sí torí àwọn ọmọ ọjọ́.
Message mo lè fún àwọn obìnrin ni pé tí wọ́n bá lóyún kí wọ́n rí pé wọ́n lọ hospital. Irú àwọn abẹ́rẹ́ àjẹsára àwọn oríṣiríṣi treatment wáyé kí wọ́n gbà. Ṣùgbọ́n ní mission yẹn wọ́n kàn rí pé wọ́n kàn bímọ inú wa dùn, ṣùgbọ́n wọn à ní mọ rírì bóyá bọ́mọ ṣe rí. Nítorí náà mo wá rọ̀ wọ́n pé tí wọ́n bá ti lóyún kí wọ́n máa lọ sí hospital. Tí wọ́n bá dẹ̀ fẹ́ bímọ kí wọ́n máa lọ sí hospital. Kì í ṣe pé bóyá kí problem dé tán wọ́n ṣe máa sá lọ sí hospital.
We've completed the cesarean session for this lady who came in some hours ago with a history of having drain-like cough, and the baby was lying across the womb. So because of the fact that the baby was lying across the womb, she couldn't deliver per vagina, and also because of the fact that she had started seeing water and she was having labor pain, we had to deliver her immediately. The baby is fine, mother is fine. But baby, because of the fact that baby was not yet 9 months, baby is being managed by the pediatricians in the nursery.
After 8 years of infertility, and what tends to go through our minds as clinicians when we have patients with that kind of background is, oh my goodness, precious baby. Believe me, the case of someone like Mr. Ademuyiwa is very gratifying, and it gives us hope that let's just continue so that we can get as many of such cases with good stories as possible. So I'm very happy for her.
When the child came in, the child was said to have some respiratory difficulty, which usually occur in preterm babies because of their lung is not yet fully matured. So the child was resuscitated and became stable after a while. So the child was placed on meal per horse, that is, he's not taking anything by mouth, was on IV fluid and IV antibiotics as well.
I've gone to so many places. So that's why I appreciate the governor of this state. I don't lose the baby yesterday. I was crying, I don't want to lose the baby. Because people of Akure are rejoicing with me that I'm pregnant. So they told me yesterday I was sad that I don't want to lose my baby. My mother asked me, so why are you crying? I said I don't want to lose my baby. My mother said this place is the best place. It's from Dr. Olusegun Miko. That nothing will happen to my baby. So glory be to God that nothing happened to my baby and myself.
It's not easy at all. If I say easy, I'm telling you lies. It's not easy. But I can only give thanks to God that made it possible for us to have it. Actually, we've gone spiritually, whatever, spending here, there, eating this, whatever. But today is by God's doing.
She was taking care of the baby yesterday morning when she was not paying proper attention. So around that time, the baby aspirated and the baby became blue.
But you change the land, you change your change color.
She has left the baby to us. She doesn't touch. She just left the baby for us for the nurse to take care. So sooner or later now the baby will be discharged. And the baby will be with her. So the thing we just need to do is to continue to encourage her and to support her. That is all.
So one will pay come for 2 months. So that I'll be okay. But since the number me feed there, I'm okay with it.
See, the baby now. The baby is now enjoying the feed. Is this because the baby was small? That was why you were scared?
Yes.
Is this the first baby? But now you are getting used to it. It will be a very small baby. It's going to be big later. You'll be surprised. When it is about maybe 1 year, you see, and it's pregnant. Mature babies were very, very brilliant.
She's been married for 8 years. And she's been unable to have any baby. That was quite interesting, and that spurred us a little bit beyond the usual, because with draining like her, she had the risk and a transverse line baby of having a cord prolapse. That means the cord coming out through the womb because there was nothing there to stop it, and that could lead to the baby dying.
Mr. Ademuyiwa, welcome. Thank you. You have discharged your baby.
Thank you.
Being know that the baby is now fully okay, and there's no other problem. So we are discharging the baby to you, and we wish you well in Jesus' name. It's a special gift from God, and I believe by the grace of God, you yourself and your wife will be good mother and good father, super daddy and super mom, to keep the baby on. So I wish you all the best at home. And I have already told you before that in the room where you are going to keep the baby should be always warm. No extra relation. So that you carry the baby or your husband carry the baby, or if your mother-in-law is with you, you tell her to wash her hand 24/7. As you be washing your hand here, you continue to wash your hand like that. You understand? You change the pampers to wash your hand. You breastfeed afterwards, you wash your hand. So I will give the baby to your husband. Your husband will now give the baby to you that, my dear, help me to take care. I will support you.
Grandma,
So, yeah, I pray that God Almighty will guide us to nurture and to nurse him for the grace of God and the good in Jesus' name.
I'm sure she has no complaints about having a cesarean session like some of the other women, because she has a good baby, her husband is happy, she's also happy.
One index that is unacceptable is high mortality rate. The other index is high infant mortality, maternal mortality and infant mortality.